As a plastic surgeon background, also aesthetic doctor, how all you probably try to treat acne scar. We treat acne scar on the surface with the laser, and lasers move the skin, improve the quality of the skin. But acne scar means tissue damage. So we need to do something also to help the tissue, the dermis. The first presenter, Dr. Nunk, talked about stem cells, exosome. I use it. I use SPF, I use the nanofat as a plastic surgeon, and I made at university some research about it. So it's very powerful to regenerate the tissue. But I cannot ask my patient to do this in the bedroom. I have to go in an operation room. It takes time, it's expensive, and one session is not enough. Second, relator talked about growth factors like, I use growth factors, I use PRP, I love it. I made research at university, I'm professor at University of Rome, and it's very powerful to have the tissue. But I need to ask the patient to have the blood. The cost is higher, and one session is not enough. So we need to repeat the sessions. So basically, just to make clear, the most powerful regeneration treatment that we have are PRP, are nanofat. But it's time consuming, it's expensive. A few years ago, I came across something different. High purify polynucleotides. Polynucleotides are fragments of DNA. I started to make some research and learn and study, and there were some articles that were very encouraging, say, okay, they are regeneration powerful, and I start to say, okay, at university, we do some research and see if it's really help for us, because it means just take the product and inject. That's simple. It's cheaper, it's quicker, and we can do more sessions and see what's happened. And this was the first paper, the first article, and we tried to compare the use of hyaluronic acid, or you use it, very simple operation, and say, okay, see what's happened if we treat our patient with hyaluronic acid, but before it, pre-treat the patient with polynucleotides. Why this? Because from the research point of view, if I need to prove if something is helpful, if something clinically, scientifically works, have to make this kind of research. You have to think about. And we say, okay, we take a patient and we treat with hyaluronic acid and nasal labia fold. Before it, we use just enough outside to use nasal labia fold. We pre-treat with polynucleotides. And the result was incredible. I don't know how many of you see this article, but you can read it. You see the two different curves. Now, the higher curves means that the hyaluronic acid pre-treated with polynucleotides lasts longer and is more effective. So it means that if you want to treat your patient with hyaluronic acid, that probably most of you do it, and you pre-treat with polynucleotides, you get better results in terms of amount available and the lasting time. And the conclusion was that obviously polynucleotides are safe, effective in wrinkle reduction and improve nasal labia fold. And we start to think about the concept of a primer. You say, okay, when we do procedure in aesthetic medicine, what's happening if we pre-treat a patient with polynucleotides as a primer in terms to improve the quality of the second treatment that we do. The first research was very encouraging. And then as a surgeon, plastic surgeon, I start to see, okay, let's see what's happened on the post-surgical scar on wound. This is an article just presented in Milan last year, but is under revision for publication. And we see, I don't want to annoy you with all these details, but you see how we measured the scar with a specific equipment, and we treat the scar with polynucleotides, and we saw that the scar, compared obviously with a scar not treated, improves better. Obviously, clinically, I want to show you this because I want to make clear, clinically, it's not so easy to see the major difference. So we don't have to think about that we treat patients with polynucleotides, but also with PRP, also with nanofat, and the scar disappear. Mostly you can see this is from scientific point of view, but this is the basic of how practice. Okay, so nobody has to think that treat patients that want to improve the quality of the skin. A clinical say, okay, I give you 3-4 sessions and you see the skin fantastic. It's not like that. But it's not like that also with PRP. And on this other publication, we conclude that prospective randomized study will be necessary, obviously, to investigate the clinical effectiveness in a larger cohort of patients. The first 2 articles that I published are obviously with 20-30 patients. We need a larger case. And now this is the article that I will present today that regard the acne scar. It's been published in Aesthetic Surgery Journal, so very proud of it because Aesthetic Surgery Journal is a journal for surgeons. Okay, and it was very interesting because it was the first that I know that was a prospective randomized study. So basically, this was my idea. How can I prove that polynucleotides works from scientific point of view and not just from clinical point of view? The other thing I have to do, I compare against placebo. And 2 groups of patients, 10 and 10. It's not easy to have a larger cohort because have to be 2 groups where you see all the parameters assessed, obviously with no difference. And what we did is very simple. We treat patient with a session of polynucleotides, the assessment, you see with the Intera. We check wrinkles, hemoglobin, and texture. Result of group 1, you see, all the parameters assessed were significant, the difference. This is group 2, placebo, all the parameters assessed were not significant. Obviously, the power of this paper is because it's prospective, it's because it's randomized, it's because it's big control, not just me, that was the injector, but somebody else that checked blindly the result. So you see the result again, wrinkles and texture. The hemoglobin is not significant. What it means this, but if the polynucleotides have the regenerative effect, why have no regenerative effect also on blood vessels? And this is interesting, and we're trying to investigate this because in my idea should be also new vascularization, but probably because the cohort was not big enough, or because the Antera have not the power to investigate the hemoglobins, but it's the point that we want to check. Clinically, that is, after a few sessions, only polynucleotides, no laser, nothing else. And I think it is a good result. Before I said to you, don't expect that you inject your patient and you see the miracles, because obviously it depends on many factors. But this comes from the study, and probably was very interesting. Also, this case was very interesting. So I conclude that polynucleotides could be an alternative, validated by the science, to the regenerative ability for the tissue. Cheaper, safer, and more acceptable for our patients. Thank you for the attention.
Thank you, Antonio. Very short question, just for the clarification. As far as I know, polynucleotide